Let's bring in now Dr. Celine Gounder. She's a clinical assistant professor at the NYU Grossman School of Medicine, an epidemiologist and infectious disease specialist, and she was just named to President-elect Biden's COVID-19 advisory board. Dr. Gounder, good morning. Thank you so much for joining us. Let's dive right in. As you just heard Jeff talk about, there are now 2 task forces. So just to understand this, has there been any communication between the Biden team and the Trump COVID team?
Sadly, Kristen, there has not. And I fear that we are really in a national security crisis at this point. We're seeing surges in coronavirus cases, hospitalizations, and deaths across the country. And this is really like we're at war with the virus. If we were in the middle of a world war at this point, I cannot imagine that the current president would not be handing over the reins and providing really what is security intelligence about where the virus is, how it's spreading, and what the current plans are for countermeasures.
So if you could advise the Trump task force right now, were there communication, what do you think they need to be doing right now that they're not doing to make your job easier when you take over?
Well, I think one thing we've needed all along is testing. Unfortunately, this current administration has actively discouraged testing, but it is impossible to fight an enemy when it is invisible. And the problem with so many of these coronavirus infections is that they are asymptomatic, many of them. And so those are essentially invisible infections. So we really need to be ramping up testing dramatically, putting it in neighborhoods, including neighborhoods of color, so that people don't have to be waiting in very long lines to be getting tested. It should be as convenient as possible, and it should be free.
Dr. Gounder, there were 176,000 new cases on Friday, and we're seeing spikes all across the country. So just to put a fine point on it, what can we do, and is there anything that can be done to stop this trajectory as we head into winter?
Well, I think sadly we are without true leadership from the White House right now. I think at this point, every American has to take personal responsibility for themselves, for their families and their communities. I think we can do that. And I think the first step is for every one of us to wear a mask when we're outside of our households. Unfortunately, masks have been politicized. As far as I'm concerned, that's like politicizing toilet paper. This is a basic hygienic measure that is highly effective at protecting yourself, at protecting others, and would do already a lot if we just did that one simple thing.
Quick last question, if I can. Obviously, we focused on vaccine development a lot. Soon distribution begins. When the Biden administration takes over in January, does it just sort of have to pick up the ball and start over again? How will that affect average Americans in terms of the distribution of this vaccine?
Well, in terms of the Pfizer vaccine, this is probably going to be distributed largely by hospitals, by private pharmacy chains like CVS and Walgreens, and by state and local health departments. And so none of those are under the direct control of the federal government. And so the interfacing between the Biden team and each of those different groups can be happening right now and is happening right now. So we are moving forward with our planning because this is an emergency and we need to be ready to go on day one.
Right.
All right. Dr. Celine Gounder, thank you so much for joining us and for all of the information. Really appreciate it.